Good afternoon, and welcome to Live Healthy Miami Gardens Facebook Live weekly health and wellness series, brought to you by the City of Miami Gardens, Live Healthy Miami Gardens. Our goal is to bring our community information and resources to help us make the healthiest choices possible for ourselves as a Miami Gardens community and our families. My name is KeTia Harris. I'm Community Health Data Specialist at JTCHS Community Health System, Program Manager for our Breastfeeding Touchpoint Program based out of JTCHS Miami Gardens or our Barbara Jordan Clinic, member with Live Healthy Miami Gardens, and your host for today. Live Healthy Miami Gardens was born from the realization that although health is largely influenced by our individual choices, the conditions in the communities where we live, learn, work, worship, and play are also major contributing factors to the racial and ethnic health disparities and healthcare disparities faced, as well as our overall ability to make healthier choices. We understand that these conditions are systemic, historical, and continue to impact us as communities of color here and as a whole here and now. Live Healthy Miami Gardens is a community initiative and part of the city's efforts to address these conditions and reduce poor health outcomes through the transformation of policies, our environment, and the healthcare system overall, making the city of Miami Gardens a healthier place to be. Joining us today to talk about women in nutrition is Daphne Joseph, Community Clinical Linkage Program Coordinator and Data and Evaluation Committee Co-Chair. Welcome, Daphne. Thank you for joining us today. Can you tell us a little bit more about yourself?
Yes, Katia, and thank you again for having me. So, as Katia already mentioned, my name is Daphne Joseph. I am the Community Clinical Linkage Coordinator with Trinity Church Peacemakers Family Service Center. And as you can see by the last name, I am of Haitian descent. I am born and raised in Miami-Dade County, so I am a native. And my educational background is in community health education. I am certified as a community health education specialist, and I also have a background in psychology. Yes, so I am basically a community or public health, public-hearted person who has the community at heart and is very passionate about the health and nutrition and the mental health of our community. And I am just so glad to serve as a beacon for our beloved city of Miami Gardens.
And thank you so much, Daphne. And I know that the Trinity Church is also a partner with Jesse Trice Community Health System. Oh, actually, we're your partner with all other partners, partnering with the Community Clinical Linkage Program. Can you tell us a little bit more about that program?
Of course. So, our community clinical linkage program is actually funded by the CDC, the Center for Family for Disease Prevention and Control. I'm sorry. And we are funded to serve our community, Miami Gardens, to make sure that our residents have linkage or have access to the health preventative and intervention programs that we have implemented in the community. So that involves our nutrition education program, our diabetes education program, and we are just basically targeting the part of our community that has either hypertension, which is high blood pressure, diabetes, morbid obesity, or whatever chronic disease that the members of our community are actually dealing with. We have programs in place for those members to make sure that they have the education, the support, and whatever they need to combat those diseases or those conditions. The reason for that, as Katia mentioned before, we have done our research in our community and we found that there is an actual need where I believe it was research done maybe in 2015 or 16, where we found that 70% of our residents are actually taking medication for hypertension. And there is a great percentage of our community that has diabetes as well. So, of course, we identified this as a public health need and we implemented the diabetes program, the nutrition program, and partnered with University of Florida as well as Alliance for Aging to implement those programs in Miami Gardens. And myself serving as the clinical linkage coordinator, I bridge the gap between the services and the community to make sure that the community have access to these services. I can answer all of their questions about the programs, enroll them in the programs, let them know when the next cohort is happening, and so forth. So that is a good gist of what we do with the CCL program, Community Clinical Linkage Program.
Thank you for that. And taking in consideration everything you just said, especially with what, from what I understand, are the disproportionate rates of hypertension, diabetes in our communities. Like you shared, that with that also comes the increase of needs of medicine, taking medicine, and just everything that comes with chronic disease. Why is it important? With that context, why is it important that we overall should be mindful of what and how we eat?
That is a really good question. The reason why we should be mindful of what we eat regarding having to take medicine to reverse the effects that we're causing our body when we're eating harmful foods, we have to keep in mind that food is our first medicine. We're consuming this just as much as we're consuming the prescription pills and whatever it is that we feel that is affecting our body. For example, we'll say that we should stay away from a lot of salt because of whatever reason. But if you are actually being mindful and reading the labels, actually taking the time when you're shopping, for example, I have this water bottle here. Let's say that is a cup of juice or a bottle of juice, and we look at the label and we see that okay, it has 28 grams of sugar, it has 500 milligrams of sodium. These are really high amounts. And if those amounts surpass 26%, then it is surpassing the recommended amount that we should be consuming sugar and salt within our diet. So we should actually just be mindful of everything that we're consuming the moment we consume it, so we wouldn't have to try to intervene and try to lower our blood pressure or try to lower our blood sugar or our cholesterol if we're being mindful in the first place. So it is really important to make sure that we're eating healthy, we're taking care of our bodies, we're exercising, and we are reading labels and we're consuming our grains, having a plant-based diet. Not saying that you have to be vegan or vegetarian, just making sure that we're having a large consumption amount of fruits and vegetables. So yes, it is very important that we be mindful of what we eat.
Okay. And how has, in your experience, because you've been doing this for about 3 years now with the clinical linkages program.
Yes.
So in those 3 years, how has bridging the gap or creating that link between the clinics and the community, how have you seen this help foster healthy, nutritious eating habits in and for our community?
Yes, it definitely helped the participants of our programs foster a healthy eating or foster a healthier lifestyle, because now they have the education, they have the knowledge to do better. If you know better, you'll do better, right? For
Right.
example, one of the things that we teach our participants, and I know I keep touching on sodium and I keep touching on sugar. Sodium, if you consume, which is salt, if you consume a lot of sodium, it causes a lot of water retention. It causes inflammation. And with those things, of course, it restricts our blood vessels, causing our heart to work harder over time to pump body throughout our body, throughout pump blood throughout our body. I'm sorry. Yes. So of course that is what causes high blood pressure. With sodium, I'm sorry, with sugar, sugar is actually used to either do two things: either be converted into energy, and the extra sugar that we consume would then be stored as fat. So if one day, I guess your body is kind of storing sugar as for a rainy day, if you're not eating as much or whatever, then it can use that fat and convert it into energy. But if you're consuming too much sugar, then you're having more fat being stored in your body. So just knowing those two things will make someone a little bit more mindful of what they're consuming, along with reading labels, knowing how much grams or milligrams of sugar and salt that you should be looking out for, what the recommended amount is, the daily recommended amounts are for someone who just wants to eat a regular diet versus someone who's on a diet and is looking to lose weight or a low sodium diet, a low sugar diet, and so forth. So just making sure that we provide that education, and making sure that we just talk about how the different foods that we're eating and the different things that we're doing, having more of a sedentary lifestyle where we're not exercising too much, how that can raise our LDL levels in our cholesterol, which is considered the bad cholesterol. So yes, just making sure that our community is well aware of all of the things that I mentioned and more can help them foster a healthier lifestyle.
Yeah. And I heard you when you said, I know I keep talking about sodium intake or salt intake, but it's important that we talk about it, especially we're just kicking off also Heart Health Month. It is still heart, yes, February. Heart Health Month. And that and sodium and salt intake is also impacts, from what I understand, correct me if I'm wrong, impacts that the health of our heart and the potential of chronic diseases associated with that and others, when we're talking about intake of anything, or even with diabetes and the sugar intake and everything like that. So I know you talked a little bit about the nutrition services and the diabetes self-management programs. Could you talk a little bit about what, or are you able to talk a little bit about what that entails, or the partners that are connected to the nutrition programs or the community clinical linkages programs associated with the program?
Yes, of course.
The
Yes, so our
program.
diabetes prevention program, which is the DPP program, we offer to the residents of Miami Gardens, which is a 6-week program. We partner with Alliance for Aging, which is a community-based organization here in Miami-Dade County. I was going to say Miami Gardens. It's Miami-Dade County. They do provide services throughout Miami-Dade County. And with that, we are just educating anyone who is pre-diabetic or diabetic. They do qualify for the program, so they can learn more information about how they can cope with the psychological effects of having diabetes, learning how to manage their medicine intake a little bit better, making sure we're keeping track of our appointments, and most importantly, making sure that we are being mindful of what we eat, limiting our refined carbohydrate intake, which of course we know that refined carbs does convert into sugar as well. So that is anything made with white flour, white rice, pasta, um, anything made with white flour, white bread. If it has white in front of it, is made with white flour. Yes, so just making sure that we're teaching our participants about the important aspects of being diabetic and how you can make sure that you're living a healthy lifestyle so you can possibly even reverse diabetes. Diabetes is actually reversible. We actually had a participant in one of our classes who followed all of the recommendations, everything we taught in the class, and he was in the class along with his wife, and his wife was actually helping him make sure that he maintained those diet recommendations because, of course, he's making his meals for him every day, and with that, he was able to lower his A1C levels, his glucose levels, and to the point where he didn't even have to take his medication anymore. And that was a really great story that we share with our future participants to let them know that this program is actually effective. We have a testimony. So if you're actually following all of the recommendations, then of course you can reverse the diabetes as well. Of course, everyone's situation or case is different, which may require a little bit more exercise here or a little bit more tweaks there, and but it is reversible eventually. And with the nutrition program, that program is a little bit longer. It's a 9-week program, but it is not limited to anyone that has diabetes. You can just simply be a resident of Miami Gardens. We do require, or our partner, which is University of Florida, requires that you are qualified for any type of public assistance. That can be WIC, food stamps, Medicaid, so forth. If you are qualified for those programs, then you are qualified for the nutrition education program. And with that, you are learning everything I just mentioned, all of the reading labels, teaching you how to look out for certain things, cutting certain things out of your diet, how certain things affect your diet, affect your health, cause inflammation, cause restriction of the blood vessels, and so forth, causes water retention, weight gain, impact your hormones, and so many different things. We do cover all of that in the class. And of course, we also do some exercises in the class. So if you're someone who has a really busy lifestyle, another reason why the classes, along with the CCL program, why it's beneficial is because we have a accountability partner, which is myself. I do reminder calls, reminder text messages. We do talk about, if, for example, we talk about our goals when we enroll into either class, whether it's the diabetes class or the nutrition education class. And I simply ask the participant, what is your health goal? What are you looking for when you enter this class or when you come out of the class? And how can I help you with that? If that requires me to send you a quick text message to say, hey, you said you were going to do 50 sit-ups before you go to sleep, so make sure you do those 50 sit-ups, or just giving you a quick phone call because you know you're not too good with remembering to join the classes. I do class reminders as well for each class. Yes, so I do serve as a accountability partner as well as just keeping everyone on track with their health goals if they decide to make a health goal. Sometimes we have people who join the class and they just say, I just want to learn, and they don't create a health goal, and you're still allowed to be in the class as well. So it's a really good opportunity. The CCL program is a really good program within itself. And we do have some things in store for it. With Trinity Church, we're seeing if we can provide some more classes or implement some more classes. So definitely stay tuned for that. We have more information for our community regarding that as well.
And these are the programs that will be now hosted through Trinity Church specifically.
Right.
Beautiful. Yeah. I'm looking forward to that. And I know just the outcomes, just as you shared with one of the diabetic patients, and not having to take the medications anymore, must be a rewarding feeling for him as someone who had to previously take I wouldn't even know how many medications, even if it's just that one, but even as you as the program coordinator and for the program overall, seeing the outcome and what was possible and what is possible for our community if they take advantage of this free opportunity with diabetes self-management education and nutrition education. So thank you for sharing all of that. Hear about women in nutrition. And I know, and I'm looking forward to what you're about to talk about with this one. I know when it comes to women in nutrition, and I'm not a nutritionist, and I know from when we just talked, you say you're not a nutritionist either. But I know that what and how we eat, we were discussing this before, what and how we eat upon pregnancy and while breastfeeding may have to be modified to address the needs of the mom and baby alike. Like for upon pregnancy, I know there's some things that mom may not be able to eat for the well-being of the baby, but then there's some things that the mom may need to increase as far as nutrients goes, or vitamins and minerals while pregnant, but also while breastfeeding, to make sure she has what she needs to maintain her optimal status of health, or to be as healthy as possible. And the community clinical linkages program has an upcoming, very specific, but just as necessary opportunity to educate our community about this specifically. Can you talk a little bit more about that?
Yes. So we do have a upcoming class, as KeTia just mentioned. It is a nutrition and education class, but we're specifically targeting pregnant mothers, breastfeeding mothers, or mothers who have recently given birth. And we're just talking about basically the hot topics all around, or what comes under that. For example, foods or that may increase lactation. And if you may just have had a child, how to get that baby weight off of you, right? And of course, having we talk about physical activity, we talk about nutrition and dieting and so forth, and having with the CCL program, having I am sorry about that. I am so sorry about that. But yeah, just making
That's
sure.
what we're calling for the class now.
That's calling for the class. See, all those spots may be taken up. You gotta hurry up and get in the class while you can. But yes, as I was mentioning, I believe we were talking about the hot topics that we would cover in the class. So we talked about dropping the baby weight. We talked about increasing lactation. We talked about certain foods that we talk about certain foods that mothers should stay away from as they're breastfeeding or if they're pregnant. Of course, we know that we should stay away from foods that are high in mercury while you're pregnant, but there are some additional foods that you should stay away from that the nutritionist or the health educator that facilitates the class, they will go over that once you join the class. So there are a lot of great subjects that are covered through each class. And of course, this is the perfect timing to have this class. I don't know if you realize that, but March is actually Women's History Month. So why not have a nutrition class for women and mothers in the month of March? I think this is perfect timing. So yes. So of course, if anyone is interested in the class, my information will be shown below. My email, you can email me, you can give me a phone call. Just let me know that you're interested in the class and I can enroll you. The enrollment process is fairly simple. I just need your information and we do a pre and post survey, just getting a gist of your eating and nutrition habits beforehand. And just making sure that once you come out of that class, that the program is actually effective and we're seeing a difference in your eating habits, your exercise habits, and so forth. So yes, that is just a gist of the program. And of course, I have more information for you. You can give me a phone call. I know we are already getting phone calls for the class because everyone is just hearing about the class and they love it and they want to enroll as soon as possible. So you can definitely give me a call and I will be more than glad to give you more information about the class.
Thank you again, Daphne. And I know there's a flyer that has this similar information from UF, but then there's also one that's tailored to the breastfeeding moms and pregnant and breastfeeding moms. Oh, here it is. And if nothing else, what would you like to share with families joining the Facebook Live, either right now or later on through the recording, who are pregnant, who are breastfeeding, or who are neither, and just any final thoughts or words to support those who just want to get healthier and be healthier?
Yes, definitely. I do want to say that with changing your lifestyle, basically, we want to look, if anyone's familiar with the motivation for change model, it is the same across the board. Whether you are trying to change your lifestyle, take something out of your lifestyle, implement something in your lifestyle, you may go through some trial and error. So the first thing is to be gentle with yourself, give yourself time to adjust to the change, and just basically know your background, know where you're coming from, know your triggers, what is causing you to, whether it's overeat, what's causing the high levels of glucose or the high levels of sodium in the blood, whether it's something from your diet, whether it's something that's hereditary. Just know where you're coming from and know where you're trying to go so you can know what aspects of your lifestyle that you need to change. And of course, we all know that in order to make a change, an actual lifestyle habit, it does take about 3 weeks. So you do have to give yourself some time to make that change. And of course, with the CCL program, we are here to help you make that change with our programs so you can learn about the different areas of your health or your lifestyle that you need to change, as well as having a health coach or a certified health education specialist to help you along the way. So with that being said, yes, I just give that note to everyone that is listening. And of course, feel free to reach out to me for registration for whether it's the nutrition class, for the breastfeeding mothers, the pregnant mothers, whether it's just for the diabetes class, or even if you're not a mom and you're willing to, or you want to do a nutrition class, you can do that as well. And you can reach out to me and I can let you know about the upcoming nutrition class that we have. We have all of these services implemented in the city of Miami Gardens for our residents. So definitely take use of them.
Thank you again, Daphne, for everything you shared. Thank you for this opportunity for our patients to, and our community. I'm sorry, I'm thinking about Jesse Trice, but including our Jesse Trice patients and community. This opportunity for our community to be empowered and take control of their health. And before this, I didn't realize you were an accountability partner, and I think that does make a difference than going in by yourself or feeling like you're going in by yourself versus knowing somebody's right there with you to go with you all the way. I don't know. It just with me, even hearing it in me going through the process in my head, I'm like, okay, that feels like a lot different. And I appreciate that. I appreciate you. Thank you for joining us today. Again, the information is on the ticker below to register for the nutrition education class, targeting prioritizing pregnant and breastfeeding moms. Please contact Daphne Joseph. If you are in Miami Gardens community, Jesse Trice patient, I don't know what are the other two clinics. You can also talk to your healthcare provider and have them send a referral to Daphne Joseph to take part in this nutrition education opportunity. I know we've received several referrals already. And nothing else. Thank you all for joining us today. And I hope you all have a great, wonderful Tuesday.